hope you're having a great Sunday. My name is Dr. Jason Uchida. I'm a doctor of naturopathic medicine and your host of this program on alternative medicine. Welcome to Island Wellness, a program designed to educate you about naturopathic medicine. I graduated from the National College of Naturopathic Medicine in Portland, Oregon in 1988. I have been practicing naturopathic medicine in Hawaii for the past 21 years. Naturopathic physicians are licensed in the state of Hawaii as primary care providers, just like medical doctors. Let me give you a brief introduction to naturopathic medicine. Naturopathic medicine is a primary healthcare system founded on the honored universal principle that nature is the ultimate healer. Its roots go back beyond the time of Hippocrates, the father of modern medicine. Naturopathic medicine's core belief is that our body has the innate ability to maintain and restore optimum health, no matter what the current status may be. Therefore, a physician's true role is to support this process by using modalities of treatment that work in harmony with the body's natural healing ability. Well, that's enough about me and naturopathic medicine. Now let's find out if it works. To help illustrate this, I typically ask a patient to share his or her experience with naturopathic medicine so that you can get a better understanding of how this safe and effective form of medicine works. Today's program is yet another can't miss show. Today is April 25th, 2010. In April 2009, Diedre presented herself suffering from an extreme case of fibromyalgia syndrome and rheumatoid arthritis, where nearly every single joint and muscle in her body hurt like you couldn't imagine. However, after 5 months of naturopathic medical treatment, the joint and muscle pains that she experienced had completely cleared and to this date have not returned. At this point, I'd like to welcome Diedre. Diedre, thank you for joining us today.
Thank you for having me.
I know that there are a lot of skeptics out there and they're thinking, the pain, your joint pain and your muscle pains probably wasn't that bad. Can you describe just how painful those pains felt to you?
To me, if on a scale of 1 to 10, it was greater than 10.
Greater than 10.
It was so painful that I couldn't sleep. And when I did fall asleep, I woke up many, many times
from
at
the
night
pain.
from the pain.
Can you describe which joints and muscles were affected? I mean, because I mentioned nearly every single joint and muscle was just killing you. Can you share which joints and muscles were involved?
I'll start from my head.
Okay.
Pretty much my entire head. It felt like my sinuses, the back of my head, my jaw. It ran down to my neck, my shoulders, my biceps, my triceps, my forearms, my wrists, my fingers, my lower back, my hips, my knees, my ankles, and my feet.
Okay. So pretty much every single joint.
Yeah.
Can you share with us, how the pain was in your hands and wrists? Because what I remember is that those pains were probably the worst.
Yeah. It was like spasm pain.
Mm.
It felt like vice grips were on it,
Mm-hmm.
and like somebody was squeezing it, and when I moved, like it would break. That's how it felt, so bad, like it was going to break.
Joints were going to break.
Right.
They were that painful. So you mentioned it was a 10 of 10.
Yeah, or more.
Or more. So, some people might think you're a fragile flower, you can't take much pain. Tell them otherwise. I mean.
Yeah, that is so untrue because I have 2 children and I had them naturally.
Okay.
My first daughter was 11 hours and the second one was 13 hours with no pain medication. I gave birth to 2 children.
Mm.
So I would say this was worse than giving birth.
I would say so. But also you did a lot of work too, right? I mean, not only your work, but from what I get from you and your husband is that you did a lot of remodeling yourself, right, of your homes.
Yes.
Can you explain a little bit about that, what you did?
Well, my husband and I remodeled, I would say, about 3 places. We would do all the cabinetry and the breakdown, and then the cabinetry in the kitchen, bathrooms, flooring. This last one we did was drywall. So we remodeled 2 kitchens,
That's a lot of work.
I would do, caulking, mostly the finish work, the painting, the texturing.
Okay.
And I would do it from, I would say, 6, 7 in the morning to 12 at night.
And
12
that's
in the
how
morning.
you would work
Yes.
on remodeling. So that's
Right.
not easy work to do.
No.
That's heavy-duty kind of work.
And it would be every weekend, and I was working 4 days a week at the hospital.
Okay. And then you...
And on my feet 8 hours.
Okay. So you worked hard.
Yes.
You worked full-time job, and then you also did a lot of remodeling.
And had a spick and span home.
Okay,
Yes.
okay. All right. So tell us about the fibromyalgia pain. The muscle pains, because you mentioned the joint pains to your hand and fingers. By the way, were your fingers and wrists swollen?
Yes, my fingers were swollen, my feet were swollen, my toes, I didn't have much definition in the ankles, and the swelling moved up, where pretty much my whole body was swollen. I couldn't fit in clothes. I was wearing double X blouses and size 16 pants.
Pants, okay. When were you diagnosed with rheumatoid arthritis?
This is the sad part. I wasn't told that I had rheumatoid arthritis when I went to see a rheumatologist. When I came to see you was the first time I was told that I had, or was starting, rheumatoid arthritis. I went to see a rheumatologist about 3 times over the years, from like 99, and then I saw him again in 2009.
Okay.
He told me I didn't have rheumatoid arthritis. He told me there was no hereditary factor.
Okay.
Which I have on both sides.
Okay, so...
Of my dad's sister had it really bad, and my mom's nieces, grandnieces.
Okay.
I have my first cousins, second cousins that have multiple on my mom's side. He told me if I wanted to see a psychiatrist or a psychologist, and took x-rays, didn't look at it, and made me very disappointed, being that I'm in the health field myself. And to go to a doctor and get told you want to see a psychiatrist or a psychologist was very disappointing. Because I know who I was.
Yeah.
And I know it wasn't in my mind.
Yeah, that you weren't imagining that pain.
Yes.
Oh, wow.
I mean, I had physical signs of the swelling.
Yeah.
And I didn't even look like myself.
All right. When were you diagnosed with fibromyalgia syndrome?
About 1997.
1997. Yeah. So you were suffering from fibromyalgia syndrome for, I guess, about like 12 years before you came in to see me.
Right.
Can you share more about those symptoms, how bad they were, and how they affected you?
Well, depending on what I was doing, if I did a lot more, I would have more pain. And it would move, say if it started with my hands, it would move up to the forearms and up to the bicep, tricep. It would, whatever connecting tissue. And then as I used that, it more and more, and then it lack of sleep because the pain. So then the pain came on worse, and it would come and go. So I would have good days and bad days, and I would still go to work.
Okay.
I would have a hard time even writing with a pen, pencil.
Because you have to do a lot of writing at work.
Initially, we would write stickers. I had to write on every patient that I seen, and so it affected me that way. So when I was unable to handle the pain because I would be in my jaw and my head, then I would need to, I would call in sick because I couldn't function. Then I would have a couple of days of resting, and then I would go back to work and handle the pain. But what helped me handle the pain was I would take up to 1,200 milligrams of ibuprofen every 4 hours. Not realizing what it was doing to me. But that would help the pain, and then it got to be where I went on Celebrex. And 200 milligrams every 8 hours, went to 400 milligrams to the point where the 400 milligrams didn't even help.
Okay. You were also taking Vicodin at one time?
I was given Vicodin, Tylox. I really didn't like taking any of that. So because it didn't make me think straight.
Right.
And
right.
I hated that feeling.
Okay.
So I would take them, see how it worked. It really didn't do anything with the pain.
Oh.
I
Okay.
would stop it.
Okay.
So I had a whole pharmacy of taking it once or twice and leaving it.
Okay. Diedre, the characteristic problems with fibromyalgia syndrome is the person usually is suffering from tremendous amount of pain, which leads to typically difficulty in sleeping,
Yes.
right? Which then causes great exhaustion.
Yes.
So that's the classic signs of typical fibromyalgia syndrome. So usually tremendous amount of pain, exhaustion, and then debility, meaning not able to work, right? So can you kind of share with the listening audience one more time which areas of your body, the muscles, were affected by the fibromyalgia syndrome, and what kind of pain you were feeling in those areas?
Well, again, it started from my head to toe. I mean, it was pretty much my whole entire body.
Okay.
But it was like, it felt like it was my sinuses.
Okay.
And I saw doctors for that. And so it was in my forehead, in my cheeks, in my jaw, in my neck, in my shoulders, biceps, triceps, forearms, wrists, hands, lower back, hips. So if I lay down on my hips, try to go to sleep, I would constantly move around until I could fall asleep. Fell asleep, woke up because I was laying on that joint. My knees would even go out of joint up to 6 times a night would wake me up. And I would have to try and get it back in.
It would be spasming and would lock or something?
Just totally out of joint. And I would have to try to like shove it really hard to get back into it, try to go back to sleep.
Okay.
So I wasn't really sleeping. And then, of course, the exhaustion came. So the ankles, the toes, and it was spasm pain.
So your muscles would be spasming?
Yeah, it would be like solid pain and
cramping.
then spasm pain.
Okay.
So spasm pain from use.
Okay.
And then it's spasming all the time after that.
Yeah.
If I relaxed it, and I would massage myself.
Okay.
I had massagers, tried different types with heat, without, and I would be massaging myself. So I would have relief for a little bit until I use it again. And the relief was just dull pain.
Okay.
Well, dulling the pain. I wouldn't say dull because it would be
so you still had
like
pain.
a 5 maybe.
Okay, instead of a 10.
Instead of a 10.
Right.
And then it would increase with the use of whatever it
Right,
was.
right.
So if I was sitting and watching TV and I say tensed up my jaw,
Okay.
I would have pain in my jaw.
Oh, okay.
Well, I would have to massage it. And
Yeah.
then that pain would give me like a headache and then the back of my head. So I was massaging in my entire
Your whole body. And that's a classic sign of fibromyalgia also, is that when you use the muscles, if you have fibromyalgia syndrome, the muscle pains get worse with use.
Yes.
So work really aggravated you.
Anything aggravated me.
Okay. All right.
And to the touch, I couldn't be touched.
Okay.
Because if someone even put their hand on me, I'll be out, don't touch me. If my husband tried to massage me, I'll like, don't touch me, I could do it myself. To the point where even a fan, just a fan blowing on me
would aggravate your muscle pain.
It would like feel like, oh gosh.
Can you just describe the pain you would feel, let's say in your shoulders, for the audience?
Like someone had their hands just squeezing you as hard as they could.
So it was like a vice grip, all right. Yeah. So and like a dull ache.
No.
No.
A strong ache.
Okay. All right.
Or so like somebody hit you with a bat. Or like, I don't know if you ever heard somebody say they feel like a Mack truck ran over them.
Yeah. That's how you felt.
And like it rolled over you and another car came and hit you again.
Hit you again. Okay. So you felt pretty beat up.
Yes.
Okay. Tell us about the chest pain and palpitations you also felt.
Yeah. The chest pain I had, initially it felt like from a collarbone coming down into my sternum, and I had pain on both sides of the chest, not realizing that it was all the way to my sternum.
Mm-hmm.
The only time I really knew I had it was, okay, feel, yeah, that hurts.
That hurts.
And so from there it would pull on it. And I've had where palpitations, and then I've had even from before bigeminy and trigeminy. I don't know if it was from the pain.
Oh, you mean facial pain?
No, the heart skip. My heart would skip too.
Oh, okay.
23, 24 times a minute.
Oh, okay,
Yeah.
okay.
So I had pain that felt. It wasn't crushing pain though. I knew it was.
It was.
It's
So you knew
muscle
it wasn't
pain.
a heart attack.
Yeah.
So it's probably resulting from the fibromyalgia.
Yeah.
Okay.
I could feel that it. I knew the difference, I guess, between. But then again, they say with women, it's hard to tell.
Mm.
But
And
I
you
knew
work
it
in
was,
a hospital too, so
right.
you understand that.
Yes.
You also had eczema also.
Mm-hmm.
Can you share with the audience how long you suffered with eczema and where was it on your body?
As a young child, I had rash from behind my legs. I would have also hives, not knowing why. 104 fever, and it would last for a while. My dad would make his own concoctions, put it on my rash, and then it really wouldn't go away.
Oh, okay. Too bad.
And then it went on for years and years, on and off for years, and then it got worse where I could not use certain clothes, certain underclothes. Materials would bother me. Latex glove would cut up my fingers, make it irritated. So
you would react to the latex?
Yes.
So with like hives?
Just contact
rash.
Yeah. And then I was also reacting to different foods where my airway would close up and still eat the food.
Oh, okay. All right. So we'll talk more about that later. Diedre, you're also a diabetic.
Yes.
Yeah. How long were you a diabetic, and what kind of treatment were you on at that time in April of 2009?
Yeah. At that point, I was diagnosed in 97. My blood sugar was like 186. I tried eating natural, organic food. Didn't last too long. I was on almost every diabetic pill: glucophage, metformin, Actos, glyburide. My A1C, which is that it tells how well your blood sugar been for 3 months,
right,
was as high as 12.6.
Wow.
It would.
And normal is 5.9 and lower.
And right.
Oh,
and it. So from the medication, it would come and go, never lower than 7.6.
7.6.
And so
that was the lowest.
Right.
Your
and
blood
then it
sugar
would go
was
back
with
up.
the medication.
Right. So they increased it to
the medications.
to 100 milligrams of metformin every meal.
Probably 1,000 milligrams, I would think.
Oh, sorry, 1,000 milligrams. You're
okay.
right. And because it started at 500, then went 750, then went 1,000.
Okay.
To where it was irritating my stomach, and I was still taking it.
Okay.
Causing different problems.
Yeah, metformin does cause digestive problems.
Yeah. So I would have stomach cramps, diarrhea, vomiting.
Okay. All right. You kind of talked about, what treatment you were on, right? So you suffered from tremendous muscle pain since 1997. You were diagnosed with fibromyalgia syndrome. I guess the treatment that they gave you was the pain medications.
Yeah, pretty much that was it. For that,
okay.
Yeah.
And with the pain medications, was it like helping you?
No.
It wasn't helping you?
It dulled the pain, but it didn't give me clarity of mind.
Okay.
So I would stop it, and then it was back to where I was a few days before.
Okay. And when did the rheumatoid arthritis pains start to come on, the joint pains?
Well, I always thought it was fibromyalgia, so the pain,
so you
I always
joint
had
pains
pain.
From like 97?
88.
88.
88. I would have swelling and
joint pains since 1988.
But it wasn't that bad. It would come and go maybe 2-3 times a year.
All right.
And then it got worse and worse to where the pain was there all the time.
All the time.
By the time I saw
came in
you,
to see me.
it was not going away at all.
Yeah. And you were in tremendous amount of pain at that time.
Yes.
Were you working at that time?
I was out of work for a month by the time I came to see you.
So you were out of work for a month?
Yes.
Because you weren't able to function at work.
Yeah, I couldn't even hold a knife.
Oh,
I couldn't
yeah.
even put my hair up. I couldn't fix myself up.
Yeah, yeah.
It was terrible.
So you couldn't even function at home too, you were saying?
No.
Okay.
And it wasn't like me because I was the type of person that constantly going.
Okay.
You couldn't hold me down.
Yeah, yeah. The Energizer Bunny.
You're right. That's
right.
it.
So we're going to talk about rheumatoid arthritis and fibromyalgia syndrome a little bit so the audience can kind of catch up with us because the next part of this program is we're going to start talking about the treatment that you receive from me. So rheumatoid arthritis is an autoimmune disease. Yeah? Fibromyalgia syndrome is also considered an autoimmune disease. There are many types of autoimmune disorders such as lupus, Sjogren's syndrome, scleroderma, psoriasis, ulcerative colitis, pulmonary fibrosis, and erythema nodosum, to name a few. Autoimmune disorders are caused because there are toxins in the body called antigens or foreign invaders. These toxins trigger the immune system to attack them. When the immune system tracks these toxins down, it kills them with these things called chemotactic factors and other substances of inflammation which kills and dissolves the toxins. This immune system response is called the type 3 hypersensitivity reaction that produces the tissue damage in autoimmune disorders. However, by accident, the immune system's response also damages normal and healthy body tissue, such as the joints in rheumatoid arthritis, the skin in psoriasis, the lungs in pulmonary fibrosis, the colon in ulcerative colitis, the muscle tissue in fibromyalgia syndrome, and the liver and kidneys in lupus and scleroderma. Because conventional medicine understands that the immune system is attacking and killing a toxin, and by accident it damages the human body, causing the autoimmune disease, conventional medicine's choice of treatment is to use medications that stop the immune system from working and attacking these toxins. Medications such as prednisone, Enbrel, and Remicade. When these medications fail, the next step is usually to bring out the big gun to shut the immune system down. Methotrexate, a chemotherapy medication, could be used as a last resort. Therefore, because immunosuppressive drugs only decrease the immune system's response to the toxins in the human body and does not address the toxin itself, there are no drugs that cure rheumatoid arthritis, lupus, scleroderma, psoriasis, fibromyalgia syndrome, or any other autoimmune disease. They only manage the inflammation and pain and typically can cause death from their side effects. Also, because autoimmune diseases are caused because there are toxins in the body, what happens when the immune system stops eliminating these toxins out of the body? That's right, the immunosuppressive drugs typically leads to additional flare-ups in inflammation because it causes toxins to build up in the body over time. The medical history of someone who uses immunosuppressive medications are a progression of the illness with increasing dosage of medication and or the need for stronger immunosuppressive medications over time. So how does naturopathic medicine treat autoimmune diseases like rheumatoid arthritis, fibromyalgia syndrome, and the others? Naturopathic medicine treats the toxins. The naturopathic medicines help people who suffer from autoimmune disorders because it identifies the toxins and eliminates it and prevents its accumulation in the body, thereby addressing the specific cause of the autoimmune disorders. So, Diedre, we're going to talk about your treatment now. So, what did I say was causing or producing the toxins in your body for your case?
Candida infection.
Okay, so basically, a lot of people might think, oh, candida infection sounds pretty mild to be causing some problems, but typically there needs to be something in your body that's producing these toxins. And then the immune system has to attack these toxins with a type 3 immune system reaction, which then can cause the rheumatoid arthritis and fibromyalgia syndrome. So on television, you're going to magically see excerpts from the medical books that I have here, that that's what happens when, unfortunately, we have a systemic candida infection or a systemic yeast infection. So typically with systemic yeast infections, they're caused by, the number one cause is abdominal surgery. And then after that comes taking regular dosages of antibiotics and steroids. So, and taking hormone replacement therapy like birth control pills. Did you have a history of that?
Yes, I've taken antibiotics for up to a month at a time when I thought the pain I had in my head was an infection. I've seen 3 ENT doctors and they all said, oh, it's sinus infection. So they would give me a run of antibiotics for a week, and then I'd go back and they'd give me again, and it would last 30 days.
Right. So these infections weren't resolving?
Not at all.
And you mentioned initially when we first started the program that you felt like you had pain in your sinuses.
Yes.
Was that what you're talking about?
Yes.
The sinus infections?
The sinus infections,
okay.
Yeah.
So you had several of these so-called infections.
Yeah. And then when I couldn't write with a pen or pencil or hold things, I went and I saw a doctor that said I had carpal tunnel and gave me corticosteroid shots.
Did you have several of these shots?
Yes.
Okay. And then I guess soon after that, your problems start to escalate.
And then I got diagnosed with diabetes. After that.
Yeah. And you also read in the medical books, like we went over in the medical books for you, that unfortunately systemic fungal infections can also cause diabetes.
Yeah.
Right? Because we'll learn that the yeast or the fungus only eats sugar. So obviously if you have a yeast or systemic fungal infection in your body, you're going to want to eat a lot of sugar. And if you do, more fungus will grow. And then if more fungus grows, you want to eat more sugar. And then over time, you become a diabetic.
Yeah.
Right? So, all right. So, so when we went over the medical books, did it help you understand your problem a little bit better?
Yes, it made sense with what I've been going through pretty much all my life.
Okay.
Being in the medical field, I was familiar with it.
Okay.
But not the way you told me about it. I mean, when you told it to me, it was an eye-opening experience to see it the way you said it, because all those years I saw it in a different light, the way other doctors were saying it, regular medical doctors, and they never said it that way. It was like, you have this and we're going to treat it with these drugs, and then that don't work, let me give you something else. That don't work, something else. And it never helped me.
So what Diedre is saying is that typically in the medical books, it will say that, especially pathology textbooks, that systemic fungal infections will mimic bacterial infections, from acute infections to chronic infections. So when Diedre would present herself to the medical doctors, they would imagine that your sinus infection is bacterial, let's give you antibiotics for it. But if it's not a bacterial infection, the patient won't respond to the antibiotics, which Diedre didn't respond.
Right, exactly.
So she went back and the next week, and then they tried a different antibiotic, which again didn't respond. So Diedre went back again in another week, and then they gave you another antibiotic, and then it didn't respond again.
And then I became allergic to penicillin.
Okay. Which is also common for people who have systemic fungal infections. So if you are sensitive to penicillin, you may have a systemic fungal infection that's underlying this problem and also causing other issues in your body. But this is the start of the fungal infection. So also in the textbooks, it will say that systemic fungal infections produce what is called mycotoxins and enzymes. So mycotoxins are poisons that they're releasing in your body, and then our immune system will attack these poisons with a type 3 immune system response, which can cause autoimmune diseases like rheumatoid arthritis, systemic lupus erythematosus, psoriasis, and fibromyalgia syndrome. So because of Diedre's history, we targeted the systemic candida infection to help Diedre get well.
Yes.
We also looked in the medical books, and it says that unfortunately when it comes to systemic yeast infections, there is no medical treatment for it. So there's no medications that can be used to treat fungal infections. So Diedre, would you care to tell the audience what our treatment was for you?
Diet change, and I was given 4 supplements.
Okay.
One that killed the fungus,
Mm-hmm.
one that helped my liver and kidneys, one that helped my digestion, and then probiotics to replace
the fungus
with good bacteria, normal bacteria.
All right, very good. Perfect. So we mentioned that there's no medication that we can give to somebody who has a systemic fungal infection. And the reason why is the fungus is quite strong. Typically, if you have mold or fungal problem in your house, you're going to use Tilex or X14 or Clorox on it. But if you try to drink that, you're going to die before the fungus dies. So that's why the medications, unfortunately, for fungal infections kill the patient before it can kill the fungus, and that's why we have to use a diet change to help Diedre, as well as what is a natural antifungal, which is safe for the liver and kidneys, doesn't damage those organs, so that it can help speed up this process. So Diedre, we mentioned that fungus only feeds on sugar.
Yes.
Right? So the treatment was that we had to eliminate sugars, right, from your diet. Did we eliminate just some sugars?
No, every
sugar.
Sugar.
So would you care to tell the audience what sugars are that we have to eliminate from your diet?
I would say like fake sugars, regular sugars.
Okay.
Even the organic type, like stevia.
Right.
Any of those, anything that is a sugar, pretty much.
Okay, let me jump in.
Okay.
So anything that tastes good, basically, right? We have to eliminate. So we have to eliminate all simple carbohydrates because that's what fungus feeds on. And if the fungus feed on that food, they're like you and I. They're going to make waste in about 12 hours or so, but fungus probably a little bit quicker. Unfortunately, the waste they make end up in your body, which are considered toxins, which your immune system will attack with a type 3 immune system reaction. So the foods that are considered simple carbohydrates or sugars are cookies, cakes, pies, pastries, chocolate, ice cream, candies, but also fruits, dried fruits, juice, soda, noodles, pasta, bread, crackers, white rice, potatoes, alcohol, vinegar, cold cereals or breakfast cereals, as well as dairy products, corn, soy products, mushrooms, eggs, pork, tomatoes, eggplant, bell peppers, peanuts, cashews, walnuts, pistachios, and macadamia nuts. So a lot of foods that Diedre eliminated. Was the diet hard?
Initially, yes. It was a total change. I wasn't used to eating much vegetable. Vegetable would give me a lot of gas, so I didn't want to eat it. But after you gave me a cookbook, and I strict from the day after I saw you, I stood strict on the diet. That it became easier as the time went on. I substituted the way I made my food with adding it with fresh herbs, garlic, onion. I could have pepper, Hawaiian salt I would use mostly, olive oil, sesame seed oil for my dressing, and the food began to taste better than what it did. I even started making me papaya smoothies.
Oh, yeah,
We could use like half a cup of white rice. I mean, rice
milk.
almond butter.
Mm-hmm.
I would freeze the papaya.
Okay.
Half a papaya, and then because I could have one papaya a day.
Right.
So half a papaya.
That was
and
the only
blend it.
fruit besides avocados that you
and
eat. So
avocado,
one
I ate
papaya a day.
one avocado a day with my salad, and my blood work corrected so well that my internal medicine doctor said it's as if you don't have diabetes
anymore.
All
right. So,
and of course the pain.
All right, we're going to talk about that.
Yeah.
But before we talk about how you responded, when you first found out at the office visit, and your husband was with you too.
Yes.
So I wasn't with you when you folks went home though.
Mm-hmm.
But
yeah.
When I told you your rheumatoid arthritis and the fibromyalgia syndrome and all the pain you were feeling was being caused because of a fungal infection, what did you think?
Finally, the light went on, and I felt I either could do it or die because I felt dead already.
You felt like you were dying.
Yeah, I was an invalid, I would say at that time. I couldn't walk.
So it
much.
gave you hope.
Yes,
Okay.
definitely gave me hope that I could get better.
Okay. I guess that was hope, right? Because I guess unfortunately your rheumatologist told you that it was all in your head.
Right.
The pains that you were feeling.
Mm-hmm.
Okay. Would you care to say what your husband felt about the diagnosis and the treatment? Because the treatment was going to be a diet
Yes.
change, and some supplements.
Mm-hmm. He was just there to support me, pretty much.
Okay. Because your husband, Raul, is a big dude.
Yeah.
Right?
Well, he told me that he was not going to eat the way I eat.
Okay.
But I also told him that I was going to make, and he could try it.
Okay.
And if I was going to eventually, cook for the family, he would have to do some changes.
Okay.
Which he did.
Okay.
Yeah.
So he didn't, because he was supporting you, he didn't say anything like...
No, he took
"Man,
me
that's
to the
nuts."
store.
Oh, okay. Okay.
Bought whatever I needed. Was there to support me.
All right.
And slowly was switching things.
Okay.
Yes.
Okay. Because, I would think, and most people say this on the show, that, they thought it was nuts.
Oh, yeah.
That, a diet was going to help you get well. And some supplements, so, but you followed the diet, you said,
Yes.
to the T.
Yes.
Okay. So that a lot of credit to you for doing that. Would you explain to the audience how you felt after, let's say, 4 weeks or so?
Yeah. After that time, the only pain that really went away was a spasm pain.
Okay.
I
after
still
2
had,
weeks.
I still had a lot of pain.
Okay.
But that spasm pain alone gave me, it was a change.
Mm-hmm.
So I stuck with it,
Mm-hmm.
thinking, okay, if this went away, then other things will eventually go away. And you also told me it wasn't going to be right away, that
Yeah.
I felt better.
Yeah.
So I continued to see you and felt progress. Oh, and I lost I think 9 pounds.
In 2 weeks.
Yes.
Okay. So at least it gave you some hope because things were changing.
Yes.
And I had mentioned to you that you actually might get worse in the first
yes.
6 weeks or so.
Yes.
Yeah.
But I got better.
Okay. When did you start to feel significantly better?
I would say about 6 months, really, to where my pain was about a 5,
Okay.
where I could go back to work. That's when I
Okay.
felt better because I felt more normal.
Okay.
But it's because I still had pain in different areas,
Mm-hmm.
but it wasn't all the areas.
Yeah.
But pain is pain.
Right. So if you
So-
feel a little,
Yeah.
it doesn't count.
It doesn't count. I mean, I still had pain. It wasn't all over my body, but I
Right.
still had 5 pain, in
Okay.
the arm,
Okay, I
in
see
the
what you mean.
forearm, in the wrist, in
So
the
the pain
hip,
had gone
in the-
down
Yes.
significantly from
Yes.
a 10 to a 5, but you
Right.
still had some pain.
Right.
So you're saying that the pain went away completely At about 6 months.
At about 7.
7 months.
7
okay.
months, yeah.
So, all right. How are you feeling now?
Great. I feel 20 years younger.
Okay.
When I was sick, I felt 20 years older.
Okay, because actually, I have in the notes that when I saw you in December 9th, that all the pain was gone. So that's about like 6 months or so.
Okay.
Because you started late April.
Right.
Right.
Mm-hmm.
So.
Oh yeah, by December.
Yeah.
Yes.
Because we started.
Because it was October that it was like a 5, and then November. By November, it was pretty much gone.
Yeah.
It's just by using the muscle, because I was pretty much, my muscles were, I would say, on its way to atrophy.
Oh, because of.
So I had to
non-use.
rebuild.
Yeah.
Yes.
Yeah.
So from rebuilding, it was some strain.
Okay.
But I knew why I had that strain. It wasn't that pain. It was just from building up the muscle.
Yeah.
Yeah.
You know, Diedre, you work in a medical facility, right?
Yes.
How did you find me, or what made you see a naturopath? Because, you know, it's totally opposite from your field.
Yes. I called my boss to give her updates of how I was feeling. And by the month, I called her and I told her, you know, I'm not getting better. And she told me, oh, her sister went to see you, and for allergies, maybe it's an allergy, maybe I should see you, but it's all out of pocket. Because, of course, I'm on the HMSA, and I already lost my medical. I mean, no, at that point I didn't lose my medical, but it wasn't covered by my medical.
Okay.
So my husband came home from work. I talked to him about it, and seeing the way I was, he told me he doesn't care how much it costs, that I should go and see you. And so I called, and you fit me in that day. I was in so much pain.
Yeah.
I was so grateful that you saw me that day.
We took you late at night.
Yes, very late.
Yeah, it was probably about 7 o'clock we started your
and you
appointment.
took time with me, a couple of hours at least. And by the end of that night, I knew I was going to get better. Because, like I said, it finally made sense. With everything I've been going through from a child to that time where it was just building all the way.
You were just getting worse and worse as
Yes.
the decades went on.
Yes.
Okay. You had mentioned how you're feeling now, but would you reiterate that again? How are you feeling now?
I'm feeling 20 years younger. I can exercise, do Tai Bo. I'm an Energizer bunny again. Can upside down do all the things I want to do. And more.
Oh, yeah? All right. So I know that before you would be remodeling with your husband.
Yes.
Right?
Oh, yeah.
Remodeling again?
Yes. We just finished remodeling our downstairs home. Our daughter got married, and she's living there now, and it's beautiful.
All right. So, you know, also the audience might be thinking, you don't feel any pain now because you're taking more medications.
Oh, no medications.
When did you stop the pain medications?
The pain medications, well, I stopped before I saw you.
Oh, okay.
So I was living with the pain.
Okay. Because they didn't work anyway?
Yes, it didn't work anyway.
Okay.
The ibuprofen at 1,200 milligrams every 4 hours was not touching me. And even Celebrex at 400 milligrams, it wasn't touching me.
Wasn't even helping you, so why take them?
Yes.
Okay.
And so, but no pain, so no pain meds.
All right. You know, you eliminated a lot of food from your diet.
Yes.
You know, a lot of foods that taste good. I'm sure the audience is thinking, you must have lost some weight.
Oh, yes.
Would you care to tell the audience how much weight you lost and how many inches you lost?
Oh, yes. When I saw you, the ending of April, I was 179 pounds. And by December, I lost 51 pounds. So I went down to 128. And from my measurements, because I was swollen too, I lost 58 inches from where I measured. I'm pretty sure I lost more than that in inches, but I went from a size 16 pants and double extra large blouses to medium. I probably fit in a small blouse, but size 8 pant is my low.
Yeah.
Now,
so you cut your clothes size in half.
Yes.
And you lost 51 pounds.
Yes.
51 pounds in about 5-6 months.
Yes.
That's incredible. You know, and would you care to show the audience your picture of how you looked before?
Oh gosh. This was me.
When was this picture taken about?
This was actually taken maybe about 10 months before I saw you. And it was after exercising, because I would exercise pretty much every day, a half hour to an hour. And this was me. And I lost that weight with the diet and seeing you without exercising at all.
Yeah.
I couldn't. I was in so much pain. I couldn't even exercise.
Yeah. So you were exercising a lot back then.
Yes, every day.
But you weren't losing any weight.
No, I was actually probably putting on weight, but
gaining weight.
I was huge, so.
Isn't that amazing? Terrific. 51 pounds. Congratulations.
Yes, thank you. I'm back to where I was before. Many years before, say 2004, before this started spiraling to that level.
All right. We'll get you a better picture on television so you can see that a little bit better. Amazing. So you lost how many inches?
58.
58
from the
inches.
Areas that I measured.
Right.
Yes.
Right.
So it's not everywhere.
It's like waist and chest and arms and legs. Okay.
Yeah.
All right. Would you like to tell us what happened with the diabetes? You talked about that a little bit, but would you care to talk about that a little bit more?
Yes. I was on, before when I saw you, I started taking regular insulin because the pills was making me sick. The medication for diabetes that I was taking, the pills.
Metformin and glyburide.
Yes. So I was on Lantus at 50 units
Okay.
a day, and Humalog anywhere from 4 to 22 units every meal.
Quite a bit.
Yes.
So and you're not type 1 diabetic, right?
Not diagnosed at all.
You were type 2, and you were taking a lot of insulin.
Okay. And I had gone down to taking nothing.
Nothing medication
at all.
No insulin?
None at all. And my A1C was 5.7.
What did your doctor have to say about that?
He's an internal medicine doctor, and he told me that it's as if I have no diabetes.
Was he surprised that you were able to bring it down?
Yes, very surprised, because he tried many years from when I was diagnosed all the way to now. He tried and up medication. So he was very surprised because obviously it wasn't him.
Okay. That helped.
Whatever he did, it didn't help.
Yeah, so the medications didn't help you. You had mentioned that your A1C was fluctuating from 7.6 to 12.6.
Yes.
What's your A1C recently within the last 6 months or so?
5.7.
5.7?
Yes.
So it's normal now?
Yes.
So not a diabetic?
Yes.
Okay. Not considered a diabetic with that A1C level.
So if I misbehave, I have to take insulin.
Oh, okay.
Yes.
So your blood sugar rises
Yes.
fast. So, okay. Diedre, we only have about 5 minutes left or so. I know the diet is a pretty big part of it, but was that diet hard for you, eliminating all the simple carbohydrates and the other foods?
Looking at the diet, what I was expected to do, yes, because I was eating all the other stuff.
Everything else.
So I had to totally change everything. I went through my cupboards and just got rid of everything and had to rethink it and start from scratch, everything. So I just replaced just all my food, pretty much.
Yeah, totally different person, I guess, now.
Yes.
Are you surprised that you were able to not only address the fibromyalgia, the pain, the suffering, the fatigue, the insomnia, the rheumatoid arthritis and the joint pains, and the diabetes? Are you?
Yeah, I'm amazed.
That you could address them all with, I guess, simple diet change.
Yes.
Yeah. But no doubt it was hard.
It was.
Yeah. What would you like to tell anybody who does suffer from rheumatoid arthritis or fibromyalgia or diabetes?
First of all, see Dr. Uchida. that would be the best advice I can give them, that everything that these diseases took away from me, it's taken away from you. And if you go and see, because it's the supplements, it's the diet change, it's the follow-up, You gave me feedback all the way, and so and kept me going. So pretty much that. It'll change your life, and you can have your life back. The life that you've had prior to all of that, you could have it back, and that's what I'm looking forward to. I'm the type of person that would go Disneyland and ride all the rides, run through it like a kid. In my 40s. So I mean, I'm still in my 40s, but in my earlier 40s. So Disney World, I'm a kid. And I couldn't do it. There was no way I could do it. I was miserable.
Did you? Because you were suffering quite a bit.
Yes.
Like let's say last year, the year before.
Yes.
Did you ever think you would be able to get your old life back, like what you were saying?
No, I thought I was doomed and was going to be like wheelchair bound. I was on the verge of that because I couldn't even stand up for 10 minutes. The pain was head to toe. And now I'm happy to say I'm going to Disneyland.
That's right. You are in June, I believe you're saying. Congratulations to you. Had you heard of naturopathic medicine before?
No, my boss told me about it. Well, I've heard people that talk about organic this, that, but not really. No.
What would you like to say to anybody who has no idea what naturopathic medicine is?
It works. It totally works. You have to do your part, but it totally works. And do it. It's worth every penny that you worked for in all your life to get your life back. It's worth anything and everything.
That's thank you. That's an amazing statement. Thank you.
Oh, and I really wish regular medicals would cover greatly. Because financially, other people might not be able to do it. And I've spoken to HMSA. But it looks like, let's see. I'm hoping that they. Because I know there's other medicals that cover. That
does cover it.
Yeah, but they don't cover much. So,
So HMSA doesn't cover naturopathic medicine, but HMA does. So HMA is the provider for, I think, the teachers union. So I do see a lot of teachers now. So if you have HMA, you may want to give HMA a call and find out if they cover naturopathic medicine. If your policy does, anyway. But Diedre, amazing story. Thank you so much for sharing your story with us.
Thank you for having me. I've been blurting out everything to anybody and everybody who wants to hear.
Well, you have an amazing story to tell, that's for sure. I'm sorry to say our time is up. Diedre, again, thank you so much for joining us and sharing your incredible story with us on Island Wellness. I wish you continued success and good health.
Thank you. Thank you very much.
I'd like to thank all of you for tuning in tonight or today, and I hope that you enjoyed the program and learned something of value. This is our 11th show on Olelo Television, so if you've missed any of the past and you enjoyed this show, I hope you continue to look for Island Wellness on Olelo Television on channels 49 and 52. My name is Dr. Jason Uchida. Goodbye.